Unlike many medical conditions, you can play a significant role in choosing your treatment for kidney failure. Your kidney care team will give you the information you need and support you, but in the end, it's your decision. The best choice is always an informed one that you have made yourself. So it's important that you understand your treatment options and the likely impact each will have on you, your family, and your lifestyle. There are 3 treatment options available for someone with end-stage kidney disease: dialysis, transplant, and supportive care. There are 2 types of dialysis: hemodialysis and peritoneal dialysis. Both treatments perform some of the functions of a healthy kidney by cleaning the blood of waste. These treatments should help you feel better and live longer, but they don't cure kidney failure. Over the years, kidney disease can lead to other health problems like heart and bone disease, nerve damage, infertility, and malnutrition. These problems won't go away with dialysis, but doctors now have new and better ways to prevent or treat them. You should discuss these complications and their treatments with your doctor. In peritoneal dialysis, a dialysis solution is drained into a space which exists in your abdomen, called the peritoneal cavity. As you go about your life, this fluid inside you acts a bit like a magnet to draw waste from the surrounding blood vessels into the cavity. The peritoneum wall allows water and small waste to pass through, but blocks the elements you need to retain, like the larger blood cells and most proteins. After a few hours, when the dialysis fluid is saturated with wastes, it's drained out of the body through a flexible tube called a catheter. Then the peritoneal cavity is filled with a fresh bag of fluid, and the blood cleansing process continues. Peritoneal dialysis is performed by the patient themselves at home. In one type, the fluid is changed 4 times a day. Another is performed at night with a machine that drains and refills the abdomen automatically. Hemodialysis can also be done at home by the patient. In this treatment, the patient's blood travels through tubes into a filter called a dialyzer. The dialyzer removes waste and excess water from the blood and is usually disposed of after each treatment. After filtering, the cleaned blood flows through another set of tubes back to the patient. The hemodialysis machine monitors the process. While each patient will have different needs, the treatment will usually last for around 4 to 6 hours, 3 to 4 days a week, or for 8 hours at night while a person sleeps. The home dialysis patient first learns to do treatments in a home training unit. Hemodialysis can also be done in a hospital clinic. The clinic treatments are usually shorter and less frequent, and for this reason can be less effective. It also requires you to travel to and from the hospital at times which are rostered for you. Whichever dialysis treatment you choose, hemodialysis or peritoneal dialysis, you will at some point be assessed for your suitability for transplantation. A kidney transplant is generally the best treatment for kidney failure, but it's unlikely to be immediately available and it may not be suitable for everyone. A donated kidney may come from an anonymous donor who's recently died or from a living person, usually, but not necessarily, a relative. The donor kidney will be placed into the abdomen and connected up to blood vessels and to the bladder. The damaged kidneys are left in place unless they're causing infection or high blood pressure. The immune system protects a person from disease by attacking anything that's not recognized as a normal part of the body, so the new kidney should be a good match for the patient. The patient will take special drugs to help trick the immune system into accepting the new kidney. Kidneys from living related donors appear to be the best match for success, but kidneys from unrelated people also have a long survival rate. Patients approaching kidney failure should ask their doctor early about starting the process to receive a kidney transplant. Dialysis treatment and transplantation bring about major lifestyle changes, but most people find ways of dealing with the challenges. Quality of life can be excellent, particularly for those who are otherwise in good health. However, other illnesses may arise. For instance, there's a greater risk of heart disease and circulation problems. A gradual decline in health and a loss of independence can make life seem unbearable for some. And the prospect of dialysis treatment and transplantation can be overwhelming. Whatever the reasons, some people get to a point where they feel that treatment is a struggle. Choosing to stop dialysis or not even begin it is not an uncommon cause of death for people who have been having treatment for a long time, particularly those who are elderly.
A decision to do this treatment or not is very much your own decision. It's not.
If you decide that dialysis or transplant is not for you, then your healthcare team will support you, using diet and medication to stay as healthy as possible without dialysis. Your lifespan, however, will be limited.